Save them now. It's the hashtag we here at Joy News are using to complement efforts to raise funding for to raise funding to help support the Comfort Teaching Hospital, to make sure that we raise a newborn unit of the hospital to support the maternity unit. It is because in the first of the special assignment documentaries, we also got the final through Seth Kwame Boateng that a unit there that had been left uncompleted for the last 30 to 40 years needed to be completed. But in the meantime, how do we support them? There's a special fundraising activity that will be performed, and the launch will be 5 p.m. today. It will be live on both TV and radio, as well as online. And it's in support of all that, in collaboration with the First Lady, Rebecca Kufuor. 10 million Ghana cedis to be raised following that. And with the hashtag Save Them Now, Save Them Now, you can help us by increasing communication on the subject on your various social media platforms, but also more so the ones that we have. Join us on TV, our Twitter handle, and let us know what you think about how you can also support. Because from 5 p.m. you'll get to know how you can support through the various account numbers we have, and also mobile money account numbers for you to help us raise some 10 million Ghana cedis to support a temporal structure we want to build, a one-story building we want to put together for the Comfort Teaching Hospital. But currently, doctors in Ghana, they've adopted a new strategy to help reduce the menace that has led to needless deaths of babies and mothers. And today, well, we'll speak to Dr. Linda Van Otu. And Mama V and her team are there. They're ready. Mama V, what's the latest?
Yes, Roland. Roland, I'm somewhere in East Legon here in Accra. The issue is Save Them Now, the Comfort Teaching Hospital. And together with you and everybody else who is watching us now, we're raising funds, and we're launching that fund later this evening, just like you've said. But we also want to take a look at our own region, the Greater Accra region, where we are transmitting from. But fortunately for us, the Regional Health Directorate, I'm talking about the Greater Accra Regional Health Directorate, is meeting all the sub-metros in the place. So we're catching up with the regional director here, and I'll introduce two other doctors who are also joining me. But first, let's speak to Dr. Linda Van Otu. She'll give us, she'll let us appreciate what the picture is in the Greater Accra region. Good morning to you. Thank you so much.
My pleasure.
So we're talking about mother-baby deaths, and we want to understand the situation in your region as well.
Thank you very much, and good morning to everyone listening or watching. The Greater Accra region is taking a look at our maternal and newborn health. And the situation as we speak now is that last year, when we reviewed our performance, we realized that we had, unfortunately, 197 maternal deaths. And this is from the whole region, and that is very unfortunate. And we had quite a number of newborns also who were born, but unfortunately were not alive, what we call the stillbirth. And that is what we are looking at now.
We know that, unfortunately, in the Comfort Teaching Hospital, as we speak today, if today is a good day, then we know that 4 babies would die. But on a bad day, we know that more than 4 would die. I don't know what the breakdown is, because we're not even talking about Kolibo in this picture, Dr. Van Otu.
No, we add Kolibo's statistics to ours. And if we are talking about the Greater Accra region and looking at newborns who die, unfortunately, in a day, then it's about 5 to 6 in a day.
What's our reason for the deaths?
There are several reasons. In fact, one of them is some of them are premature babies, which means that the pregnancy does not go up to 9 months. We have some of them who, because of the mother's condition, and most of them is because the mother's blood pressure goes up so high, they unfortunately also are not able to survive. And then we have some who were aborted, or we have some who unfortunately were delivered and died soon after they were delivered. And there are several reasons for that. So we have some who are premature, we have some who also go to term, but they are smaller than they should be, and we have some that maybe the mother bled before the baby was born, and this baby was also born dead. And you see, there are two main types. We have what we call the fresh stillbirth, and we have the macerated ones. So some of them actually die in the womb of the woman before she gets into labor. And some of them also die when the woman gets into labor. Probably as she moved from her home to the hospital, they died on the way, or when they got to the hospital before the baby was delivered, the baby had died.
Okay. Now let me speak to two of your doctors whom you've made available, who are representing very important sub-metros in the Greater Accra region. Let's speak to Dr. Efua Asante, who is with the Osuklote sub-metro. She's also in charge, the coordinator for the pregnancy school. So very appropriate that we're having this conversation. What's the peculiar problem in your sub-metro?
In connection with maternal health, it's basically like any other sub-metro or district. But with my sub-metro, we have the situation, we have all the corporate bodies there, they come and work and go. And we have other areas, we have about 8 slums in my sub-metro. So even though sometimes you talk about the rural settings in other regions, my sub-metro has a very, not rural, but when it comes to economic status, it's low. For that matter, they don't visit the facilities early. So we have people who don't go for ANC, kids who are not immunized. And for that matter, they will end up having diseases as children or losing their babies, coming to the facilities with complicated cases. So then we have to do things, have interventions put in place for them. And then we also have the middle class still being there. And we have the lower middle class and we have lower middle class, so we have to look at them. And then secondly, they are not the issues that pertain to Greater Accra also pertain to us, as the director said, where the women don't come early, they have other diseases and with us. And as my sub-metro has the regional hospital, that's Ridge Hospital in my sub-metro, that's Osuklote sub-metro. So I have a mixture of all issues, all directed to maternal health.
Okay. And Ridge is big when it comes to deliveries. Yes. So how is Ridge containing the kind of pressure that comes to the facility?
Ridge is doing well in the sense that for space-wise, it's an issue, but we all know that they'll be moving to the bigger facility, so space will work out all right. But they have also the technical people and staff to take care of the people. And another thing Ridge is doing so well is to liaise with the facilities that refer to Ridge and sort of help us. We basically do a triage even before they get to the facility. When I talk about triage, it's looking at the patients and actually putting them into categories, which one needs attention first. Apart from the fact that they have triage, Ridge has triage units in the facility where they have a triage where they look at emergency cases, the referrals that come to them. They also have a connection with us on phone and WhatsApp where they liaise with us and look at the cases that are in trouble, give technical advice, and then we refer our cases to them. Basically, Ridge is doing that to help, even though their workload is quite huge.
So which of the facilities in your sub-metro is the weakest?
Weakest in what?
In terms of not up to scratch with equipment, with space.
Okay. Basically, when you look at Ghana Health Service, we have our big facility, that's for instance Ridge. But we have other facilities that don't have all the things because of the status they find themselves. For instance, the Braka Polyclinic is with us. They don't have a theater, so fortunately for them, they are close to Ridge, so they can refer their cases. And the other facilities like Civil Service, Parliament, Flagstaff House sees Flagstaff House people basically. So for the facilities apart from Ridge that sees other people, then it will be at the Braka Polyclinic and Civil Service. And then we have other private facilities, about 19 of them. And we have Senate with us, we have VRA with us.
So you're quite fortunate.
Yes. But so what we have to do is to be able to liaise with them and work well and put the system where you know where to send this patient at this particular time when they need the trouble.
So maybe I'm just dreaming right now because I've been watching a lot of the CSIs. In your biggest, in your sub-metro, your biggest obviously is Ridge. In your theaters, do you have like emergency phone numbers where when you're operating on somebody who has been transferred to your facility, you can be speaking to the other doctor who did the referral?
Exactly.
And the person is on speaker?
Exactly. I mean, in fact, there's one thing that has just been added where we have a WhatsApp platform. And there's, in fact, the one you see in American TV when it excites you actually happens, and it's quite exciting. Where there's triaging on the phone, and we have other doctors from other facilities there saying that you give this dosage of nifedipine, increase it, put your catheter in, put your line in, we are waiting. It's quite exciting. And it's even so exciting that a doctor can say that the ambulance is not coming and I'm bringing the patient myself. Oh, wow. That is it. And when you come to theater too, we have teams in Ridge Hospital where you have the consultants, you have the specialists, the residents who liaise with each other by phone and making sure that the team works together. You have the midwives and anesthetists and everybody on it to make sure the mother is saved. It's quite interesting outside the theater, in the theater, and in the consulting rooms.
All right, that's some good news. But irrespective of that, we still have a lot of babies and mothers dying, I must say. Let's also speak to Dr. Akosua Yisi. She is the newborn vocal person, Greater Accra English Amanfroma. I guess I got that right? Yes,
okay. Municipality.
Tell us what's peculiar about yours in terms of the maternal mortality.
Well, in our sub-municipality, we also have the same challenge. We don't have a big hospital like Ridge. Our biggest hospital is the South municipality. And in the past, we used to have a lot of maternal mortalities. One, because it's a peri-urban area. You have the rural aspect and then the peri-urban aspect. And the major issue there is that people delay in seeking care. So you would find that people wait for a long time before they report to the facility, and it affects the outcomes that these patients have. So then we continue to work such that we improve community sensitization. It's a key part, because if a pregnant woman is at home and she's not bleeding and she doesn't report to the hospital, there's not much the hospital can do if the patient hasn't reported. So then we are working a lot with the community members, improving community sensitization. And we have the arm in which we have the community service. So we have community health nurses who go out into the homes, conduct antenatal services in the home. So we bring antenatal care to you. If you cannot come to the health facility, the health personnel would come to you, come into your community, come and see the pregnant women, give them their medication, trying to bridge the gap in terms of access. So these are some of the things we've done to try and improve maternal care. And as for neonatal care, in terms of the newborns, there are lots we are doing. A key thing is that a pregnant woman should be able to at least feel her baby every day. So there's something we teach them, the fetal kick count. If you are not, director talked about macerated babies, saying that the babies die inside before they come out. But if you're a pregnant woman, you're home, you haven't felt your baby kick, you need to report to the hospital.
Even on a daily basis, if you don't feel your baby in a day, you must.
You should. By 12 noon every day, a pregnant woman beyond 16 weeks, 18 weeks, when you are feeling your baby, at least you should feel the baby kick about 10 times by 12 noon. So if by that, the whole day, 3 p.m., you haven't felt your baby pick, it's an important thing. You need to come for us to check if that baby is well and all that. But a lot of people don't know these things. So that's the reason why we are at this conference. This conference, we are trying to learn from each other as health personnel, know which districts are doing their best, learn their best practices, then the other people can also learn. So it's a peer-to-peer learning platform where we are sharing ideas in ways to improve our maternal and newborn outcomes.
This is the final day, so what have you learned from other peers that you want to take on board?
Oh, we've learned a lot. In Gasau, they piloted the color-coded monitoring tool for pregnant women. What they do is that for the midwives, when you take a woman's blood pressure, you have a simple tool that comes in red, yellow, and green. So if you have any blood pressure that is charted and it appears in the yellow zone or the red zone, it's a flag signal for you. Because sometimes when people deal with figures, they are, oh, maybe is this figure too high or it's not too low. But with the color, it just tells you she's in the red. I need to move her. I need to start a pre-referral treatment and push her. So that's what Gasouth is doing. There's one community in the Ningo Pram district where access was a problem. There are roads roads were in more trouble. So pregnant women, when they get into labor, they cannot come to the facility. So they have built a waiting room. So if you know you are going to deliver on the 3rd, a week to the 3rd or 3 days to the 3rd, you come and stay there, and we will take care of you till you eventually get into labor. And that's a very good initiative that is helping, and it's always fully booked, and the women stay there free of charge. They are not charged for hospital fees. So it's like a waiting house till you get in labor, to bridge the issue of access, because in that community there's no transportation, and at night they don't have taxis. You have to get by motorbikes, and it's so expensive. And a woman in labor with pregnancy issues, that's not the best time to put her on a motor. So it's a good initiative Mingo Pram is doing, and other places can also learn from. These are some of the best practices we have learned at this conference, and there's more to be learned today.
All right. Thank you very much for sharing. Dr. Vanuatu, so what is going wrong? I mean, you're coming up with all these very good initiatives, all these strategies, but still the rate is high.
Yes. One of the things that is not going well is the timing. The timing that the clients get to us. Mama V, you'll be surprised that in the Greater Accra region, we have some women who arrive at the hospital dead, pregnant women. And they are women who had been referred earlier and they had not gone. We are learning our lessons. That is one of them. The other one is that we have the challenge of space. So you find that some of the women come to the hospital, Tema General Hospital, Rage Hospital, the big hospitals that receive the referrals, and they sit on benches whilst laboring. Some of them have complications while sitting there. Some of them may even fit while sitting there. And the issue is also about the collaboration with the private. They are willing to work with us, we are willing to work with them. But sometimes when they get there, they have to pay because they take the health insurance, everything. Our public institutions take health insurance. When they have to go to we realized from yesterday that when they went round, the team went round to follow up on some of our staff who had been trained on skills. They realized they needed to be given a refresher to be able to perform the skills more. And what we are doing to address that is we have spaces set up in the various hospitals where the staff can go and practice when he or she is free. That means that when there are no clients to be seen, then you go there. We are putting a book there for them to take to make sure you have actually gone and practiced, because it's only through practice that you become perfect. So this is one of the other things that we are doing. And then the other thing that is not going so well is that the referral. You know, the platform that Dr. Santi talked about is very helpful. In fact, when you read some of the things that are put there, you'll be amazed that a woman can have a blood pressure over 200. That is a challenge. So we are using that, and we realize that now we need to build the capacity of more people and also expand the referral. And this is what we believe that needs to be improved.
Okay. So by what rates do we expect that the death rates will be cut down? So are you, because you should give us something to measure your performance by.
Yes, you know, Ghana is part of the countries working on the Sustainable Development Goals. And with that, it's a huge challenge. But as a region, what we are hoping is that we'll be able to reduce our maternal mortality by up to about 20%. 10% this year will be fine. 20% is fine. It takes a lot to be able to do that. Our hope is that when we move into the new hospital, we'll have more space, we'll have more theater, and hopefully when we have more doctors posted there, it will be helpful. Tema General Hospital, MTN is helping to also expand the access in terms of theater and space. That will be completed very soon. So once we're able to do this, then it means I will be cutting down on the delays that we have before women are sent to theater.
I've just got 1 minute for us to wrap up, and I thought that I would give that opportunity to you because you've been interested in what we've been doing with the Komfo Teaching Hospital. In fact, when Sir Kwame Boateng did the documentary and when we went to Kumasi, you followed up with some comments. So we're appealing for funds, essentially. That will be launched later this evening with the First Lady. But what is that piece of word to encourage people out there to contribute to this?
Yes, my piece of word is that it is really, really important. Probably you haven't seen a baby die. Probably you haven't seen a pregnant woman die. But if you should see a woman who was pregnant, she's not sick. She's just going to give life and she loses her own life. That is something that you cannot watch. And if you see a father or a mother who loses a baby after 9 months of pregnancy, that is another thing that you cannot stand. They never forget. It never goes away. So my plea is that everyone, even if it's 1 CD that you have, if you have 10 million people giving 1 CD, and Ghana we are more than 10 million. If everybody gives 1 CD, if every mother gives their child, take these 10 CDs, go and donate, go and contribute towards this. I believe that will be helpful. So no matter how small it is, save the life of a mother, save the life of a baby.
Thank you very much, Dr. Linda Vanutu, and thank you very much, Dr. Santi and Dr. Isi. We hope that your conference will go really well, and then we will be tracking the figures that you've given us. So thank you for watching, and we hope that you all contribute, even if it's 1 CD, like Dr. Linda Vanutu said. We would appreciate it very much. Over to you, Roland Walker.
Well, thank you very much, Mama Vioso Abwaje and the rest of the team. We're grateful. And just behind me, we have the inscription, Save a Child, Save a Mother, Rebecca Foundation Initiative, because Joy News and the First Lady, Rebecca Kufuado, were raising funds to construct units at the Komfo Teaching Hospital. And the launch date is today at 5 p.m. Please join TV, radio, and also online as we bring you that live event. And please make sure that you use the best hashtags and let us know what you also think about this whole initiative, how you also hope to contribute to the initiative to raise some 10 million Ghana cedis to construct a temporal maternity health block, just a 1-story building for the hospital as they await the overall grand reconstruction of the over $70 million maternity block that has been left uncompleted for the last 30 to 40 years. But that'll be it for the show this morning. We've been grateful that you've made your points this morning, but also joining us throughout the rest of the show. Please always get interactive throughout the rest of the day on Facebook, Join Us on TV, and also at Join Us on TV, which is our Twitter handle. I have to say thank you very much. And once again, join us same time tomorrow as we end a splendid week all for you. Bye-bye.